everyone, welcome back to another video presentation. Today's topic is about pain management during cancer treatment. Now, without further ado, I'd like to present to you our guest speaker for this presentation, Dr. Veronica Regueiro.
All right, everyone. Hello. Welcome back to another webisode from the Pink Ribbon Place. Today, we're going to be talking about pain management during cancer treatment, specifically some non-pharmacological options, including mindfulness, that you might be able to use to help you when it comes to managing pain. I am Dr. Veronica Regueiro. I'm a licensed clinical psychologist in the state of California, and I'm also a registered health psychologist. Today, we're going to review some of the factors that cause pain during cancer treatment. We're going to talk about different holistic options that you can pursue. We're going to talk about professionals who can help, and we're also going to talk about some things that you can do at home to help manage pain. Now, it's really important to know that all of the information provided in this webisode is based on a review of the scientific literature that is related to the topic of pain management. A lot of the information provided is also based on clinical experience and some standards of care in the world of pain management. I always also like to point out to anybody viewing one of my webisodes that the information in this presentation should not be thought of as a form of treatment. If you're really struggling to manage pain, the best thing that you can do is seek the help of a professional. Talk to your physicians, talk to your nurses, maybe ask if the social workers on your medical team have any resources that they can provide. Definitely get a professional to help you manage your pain. Use the information in this presentation to support any treatment that you choose to pursue, but definitely remember that just watching this video in and of itself should not be considered treatment for pain. Now, when it comes to cancer, it's really important to remember that pain is common to many cancer diagnoses. If you've had a cancer diagnosis, if you're currently undergoing treatment, then you know that pain is pretty common. It's a side effect for cancer in and of itself, but can also be related to different forms of treatment. One of the things that can be really scary about cancer and about undergoing treatment is the physical pain that some people experience. It's really easy to get anxious, to get depressed, to feel hopeless, to feel out of control, to feel like you're just not able to engage in life when you are experiencing a lot of pain. The good news here is that pain can be treated. It is not necessary to just suffer in silence and think, well, I have cancer, pain comes with that, there's nothing I can do about it. When it comes to pain management, treatment goals vary from person to person. Very often, treatment goals when it comes to pain management are not necessarily the reduction of all pain. For example, I'm sure everybody watching this webisode is familiar with the pain scale when your doctor or nurse tells you to assess your pain on a scale of 0 to 10. If someone is experiencing 9 out of 10 pain, it might not be realistic to say that the treatment goal is going to be achieving 0 out of 10 pain. It might be more realistic to say, okay, our first goal is going to be achieving 7 out of 10 pain instead of 9 out of 10 pain. That's how pain management works, reducing pain, but more importantly, improving function. So making sure that pain is not stopping patients from doing the things that they love, the things that are good for them. There's lots of different things that cause pain when it comes to the relationship between cancer and pain. Pain can be caused depending on the type of cancer that someone is diagnosed with, but also in how the cancer has progressed. So the stage that the cancer might have already reached, different health-related issues that are associated with cancer diagnoses can cause pain or make pain worse. There are also a lot of individual differences related to pain tolerance. You may have heard that some people have really high pain tolerance and other people have pretty low pain tolerance. When it comes to pain in cancer, if there is a tumor, the location of the tumor might be a hot spot or an area where a patient experiences pain. It's also really important to acknowledge that sometimes cancer treatment in and of itself can be painful, whether it's an assessment, whether it's a procedure like a surgical intervention, whether it's having a needle placed for an IV or to do chemotherapy. There are lots of different things associated with cancer treatment that can cause physical pain. Now, when we are thinking about cancer and when we are thinking about pain management just in general, one of the important concepts to understand is that of the mind-body connection, which is exactly what it sounds like, that there is a relationship between the mind and the body. Now, because of this relationship between the mind and the body, it is very common for most people to have physical pain negatively impact other parts of their life. Now, sometimes that physical pain can impact different aspects of their lifestyle. So maybe the way that they're sleeping, maybe the way that they're eating, but very often prolonged physical pain, or sometimes even brief physical pain that's very intense, can impact mood. It can cause a lot of anxiety, can cause a lot of sadness, a lot of depression, can cause hopelessness if somebody feels like they're out of control. It can also feel like the most important thing is just to withdraw from the world, to just curl up, not engage with anybody, which can cause a lot of social isolation and a lot of loneliness. Now, the interesting thing about the mind and body connection is that it is not a one-way relationship. It's not just that physical pain can negatively impact mood. Mood, or a person's emotional state, their mental health, can also impact how that person experiences pain. So if somebody is in a really good mood, they might have a less intense experience of pain. If somebody is feeling really anxious or really scared, their experience of pain might be more intense. An analogy that I frequently give to the patients that I work with when I'm explaining this concept has to do with being stung by a bee. So we'll just imagine that I'm walking along and a bee stings me. Now, for me, a bee sting might usually feel like a 3 out of 10 on the pain scale. But maybe if I'm having a really horrible day, if I'm in a bad mood, if I'm really anxious, if I'm really stressed out, that bee sting might end up feeling like a 5 or a 6 out of 10. But maybe if I'm having a really good day, I'm laughing, I'm at the park, I'm playing with my kids, I'm playing with my dog, I might not even notice the bee sting. Maybe I'll experience it as a 1 out of 10. That's an example of how our mood or our emotional state can impact the way that we experience physiological pain in different ways depending on our mood or how we're feeling. Now, a lot of people ask me, well, how is that even possible? How is it possible that mood or that other parts of life can impact the pain experience? Does this mean that my pain is all in my head? And the answer to that question is no. If you are feeling pain in your body, that pain is real. That pain is really there. It's just your experience, how those messages get to your brain that could be impacted based on what's going on with you in terms of your emotions. And the way that we understand this relationship is actually referred to as the gate control theory of pain. Now, in the gate control theory of pain, the way that we understand this to work is that we all have a spinal cord, right? And then we all have nerve cells in our body that run to our spinal cord. And it is along these nerve cells that a lot of messages get to our spinal cord and then get transferred to our brain. That includes messages regarding pain. So if you stub your toe, the way that your brain knows that you stubbed your toe is because there are pain receptors that travel from your toe to your spinal cord up into your brain, and then your brain registers, I stubbed my toe and I'm in a lot of pain right now. Pain messages can arrive from all over the body, and the way that these messages travel up the spinal cord is actually what impacts our experience of pain. It's helpful to think of the spinal cord as having gates or little doorways that can open and close depending on what's going on in a person's life and how a person is feeling with regards to their emotional state. There are some factors that open the pain gates. Some of these factors include stress, so feeling really anxious, really worried, really depressed, really upset about something. Boredom can also open the pain gates. So just sitting around feeling like you have nothing to do and having a sedentary life, spending a lot of time in bed, spending a lot of time sitting on the couch, just watching television or looking at your phone. All of those things can open the pain gates. And when the pain gates are open, more of those pain messages that are coming from all over your body can actually travel up your spinal cord and more easily reach your brain. Because of that, your experience of pain might be more frequent or might be more intense. Now, the good news here is that there are also a lot of factors that can close the pain gate. Some of these things include relaxation, feeling calm, whether that's through meditation or just doing something that you love, distracting yourself, maybe by reading a book, doing some sort of an art project, and being physically active. Maybe not necessarily running a marathon, but maybe doing some gentle yoga or going to take a walk. Those activities can close the pain gates. And when those pain gates are closed, those pain messages coming from all over your body, they have a more difficult time breaking through and getting to your brain. So that might reduce the frequency or the intensity of the pain that you experience. Sometimes patients have a really hard time being able to identify what is opening those pain gates, what is closing those pain gates, what is impacting their overall experience of pain. If that's something that's really difficult for you, a helpful activity might actually be to keep a pain diary. A pain diary is just where you record on a daily basis any pain that you experience, what you were maybe doing before, what you did to manage the pain. And if you collect all of this information for a long enough period of time, whether that be a week, a month, 3 months, a year, some helpful patterns can start to emerge that can help you learn, okay, when I engage in these certain activities, my pain gates are opened and it causes my experience of pain to be more intense, so more unpleasant. But when I do other activities, I notice that my pain gates are closed. I have a less intense pain experience. Keeping a pain diary can be really helpful to you just on an individual basis, but also if you're working with your doctors and working with your nurses to help manage your pain, this is actually information that you can share with them so that they can see if there are any patterns that they can identify so that they can support you in better managing your pain. One of the things that I frequently tell patients is that managing pain is all about setting yourself up for success, which basically means putting a routine in place, having a lifestyle that supports pain management. So taking a more proactive approach instead of waiting until you have a really painful or really uncomfortable experience with breakthrough pain. Waiting until you have a breakthrough experience where you're just in a lot of pain and a lot of miserable feelings, that is more of a reactive approach. You want to be proactive so that you can reduce episodes of breakthrough pain and then potentially experience less suffering and less discomfort. One of the best ways to set yourself up for success is just following your pain management regimen as it is prescribed by your physician. So if your physician tells you, take this medication on a regular basis to help with pain, take the medication. Don't wait until you're in a lot of pain and really uncomfortable, because it is actually more difficult to manage pain once it is breaking through than it is to try to prevent the pain from breaking through in the first place. A lot of folks have concerns about taking medication. They're concerned about being addicted. They're concerned about being dependent. They're concerned about just really unpleasant side effects. If any of that is worrying you, then I encourage you to talk to your physicians, talk to your nurses about those concerns so that they can help provide you with information, but also, especially if there are really uncomfortable side effects, so that they can help you find a medication that maybe works for you without having to experience those side effects. When it comes to pain management, another option that you might want to consider is taking a more holistic approach. So taking a more holistic approach, that's considered to be nonpharmacological pain management that is not dependent on medication. And there are a lot of really great options out there. One option for managing pain is massage. Acupuncture could also be really helpful, engaging in gentle movement, or other things like engaging in mindfulness-based meditation. Now, I always tell my patients, you want to make sure that before you get a massage, before you start acupuncture, that you talk to your primary physician to make sure that those activities are not going to negatively impact any other treatment that you might be receiving for cancer. One of the best ways to manage pain is taking medication in combination with some of these other approaches, which is also important to consider. So make sure you talk to your doctors, make sure that you talk to your nurses, and also make sure that you talk to anyone that you might see for a massage or for acupuncture so that everyone is on the same page about what you are going through and so that nothing that anyone is doing is negatively impacting your cancer treatment. If you're interested in taking a mental health approach to managing pain, there are absolutely therapists out there who can help with pain management. One way to find a practitioner to help with pain would be by contacting your insurance provider. You can also look at the website for the American Psychological Association or Psychology Today, or you can look at the website for the National Register of Health Service Psychologists. All of the providers on the National Register of Health Service Psychologists are licensed clinical psychologists specifically trained to work with patients who have medical conditions such as cancer. The most important thing when working with any kind of a therapist is to make sure that they are competent to address the issue that you're coming to receive help for. So you want to make sure that you're working with a licensed clinical psychologist, for example, who is maybe a pain psychologist and regularly works with patients to manage pain. You want to make sure that they have the training to provide you with good care. It is absolutely okay to ask anyone, where did you go to school? Where did you do your training? Have you worked in a hospital? Have you worked with cancer patients before? Have you helped people reduce their physical pain? You also want to make sure that you're just a good fit, that you get along with that clinician, that you feel like you can trust them, and that you feel really comfortable being open with them and sharing all of your concerns about whatever pain you might be experiencing. For some folks, it might feel like too much of a stretch at this point to contact a licensed clinical psychologist, or maybe even to acknowledge to a physician or to a nurse how much pain they're experiencing and some of the concerns that they might have about addressing their pain. There's also stuff that you can do at home. So as always, I encourage anyone who's dealing with pain to be honest with all of their providers and to reach out for support. And that can also be a really scary place to start. So we're going to review for just a minute some things that you can do at home that can help you manage your pain when you are at home if you're really uncomfortable. So one of the easiest ways to manage pain at home is called grounding. Very often when we are experiencing a lot of pain, especially when that pain is really intense, we get really caught up in that experience, and that pain draws all of our attention and all of our focus. Grounding is about refocusing on the environment that you're in. It's really easy to do, does not take a lot of energy. It's specifically meant so that folks who are really distressed, potentially because of physical pain, can engage in this activity without putting too much effort into it. So grounding can look like taking long, deep breaths and counting your breaths. Maybe if you're lying in bed or lying on a couch, focusing on the ceiling and counting either ceiling tiles or any pattern or design. For some patients, it might be counting pieces of furniture in a room, naming all of the colors that they can see. If you remember, I previously mentioned that distraction can help close pain gates. So grounding can be thought of as a way to distract yourself from the experience of pain by focusing more on your environment. So you're pulling your attention, you're pulling your focus away from that pain, putting it on something else, which can help close those pain gates. There's another activity called a 5 senses meditation, and that activity is very similar to grounding, except that you use all of your senses instead of just using your eyes to look around your environment. So in the 5 senses meditation, you can put up a hand and you're going to think of 5 things that you can see, 4 things that you can hear, 3 things that you can smell, 2 things that you can touch, and so on and so forth. You're going to go through all of your senses so that you use every single one to pay attention to the environment around you. Imagery is also a really good way to manage your pain at home. When it comes to guided imagery, there are a lot of apps and websites that you can look at, such as the Calm app, maybe Headspace, the UCLA Mindful website. They all have guided imagery recordings that you can listen to. You can also just practice this on your own by laying down on a bed, laying down on a couch. If you're sitting in a chair, just closing your eyes and imagining that you are in whatever your favorite location might be, whether that's the beach or the mountains or a forest. Closing your eyes, really immersing yourself in that experience and using all of your senses to think about what you might be experiencing if you were actually there. Now, all of these techniques are considered to be a form of mindfulness meditation. And the thing with mindfulness is that it is more effective if you practice it on a regular basis than if you use it as a band-aid once you're already experiencing a lot of pain. Very often when patients experience a lot of pain, nurses and doctors and therapists will tell them, okay, just take some deep breaths, and that can be helpful. But if it's the first time that a patient has done that, it may not be as effective as if they had practiced it and they had a lot of facility with that particular intervention. So I previously mentioned setting up a lifestyle, having routines that support pain management, and the regular practice of mindfulness-based meditations could be part of a routine or part of a lifestyle that can really support the healthy management of pain. Other pain management techniques that you can practice at home involve symbolic imagery. So these are some really cool techniques that basically use the power of the imagination to reduce the intensity of pain. When it comes to symbolic imagery, one example would be to think of a symbol that represents your pain. That might be imagining your pain as a really loud, obnoxious, irritating noise. For other patients, they imagine their pain as a really painfully bright light. And then using your imagination, you want to gradually reduce the irritating qualities of that symbol. So if you are imagining your pain as a really loud, obnoxious, irritating noise that's just flooding your brain, you want to close your eyes and you want to imagine yourself literally turning down the volume on that noise. If you're imagining your pain as a painfully bright light, you want to close your eyes and you want to imagine yourself maybe lowering a dimmer switch. And you want to imagine that as you either turn down that volume or as you dim that light, that your pain is also being reduced. This does take some practice. It does not always work the first time that someone tries, but just like any form of mindfulness-based meditation, patients who usually are more successful with consistent practice over time. The overall message of this presentation, hopefully, is to encourage you to know that pain can be managed, that the goals of pain are really the reduction of pain and the improvement of functioning, and that there are a lot of things that you can do at home to be proactive about your pain management. Whether you decide to engage in mindfulness-based meditation at home, or whether you decide to reach out to your physician or to a nurse or to a licensed clinical psychologist who specializes in pain management, there are a lot of resources. There are a lot of people who are out there to support you. You most certainly don't have to just accept pain as a fact of a cancer diagnosis and as something that cannot be addressed. Just like you would go and receive treatment to manage your cancer diagnosis to help you go into remission, there are ways that you can reduce experiences of breakthrough pain. Hopefully with this presentation, you have been encouraged to reach out to the professionals that can help you. And until you're ready to do that, hopefully the techniques that we've discussed that you can use at home will be helpful in terms of improving your confidence and your ability to manage pain in the privacy of your home. Thank you so much for letting me again be a part of the webisode series for cancer treatment and all of the things that can come with that. And I look forward to the one final episode that will be posted, I think, in December.
Thank you, Veronica, and thank you all for tuning in today. We'll be having presentations on a monthly basis, so don't forget to follow us on our social media pages at the Pink Ribbon Place for more updates and future presentations. Thank you again, and until next time, bye.